Well, thank you, Mr. Chairman. It's a privilege to serve on the subcommittee with you. Madam Secretary, it was a pleasure meeting you earlier. I want to center on the Affordable Health Care Act, or law, I guess. And first of all, obviously your background is pretty impressive. Being a health commissioner and governor of the state, you obviously understand health insurance pretty deeply. Have you ever purchased, though, a health care plan for a group of individuals, other than the state? I mean, for 50 employees, 100 employees?
Yes, sir. I ran the state health insurance program, which was the largest covered group in Kansas for 90,000 covered lives. So we negotiated 10 or 12 various competitive plans, kind of the exchange that we're looking to set up in states around the country. It's exactly that model.
Okay. Again, that's a very large group, obviously. Just to understand my background, I'm an accountant by training, a business owner for the last 31 years, and I've been buying health care for the people that work with me for 31 years, so I understand, fee for service. I understand a self-insured plan where you're buying aggregate coverage and specific coverage. I know about PPOs and HMOs, and obviously with the background with my daughter, having to, seek out the best surgical technique for her, I always made sure that the employees that worked with me had that exact same freedom in a fee-for-service type of plan to be able to go anywhere in the country to do that. So, basically what I would do is I bring the perspective of a business owner, a business manager who will be making the kind of decisions, on health care coverage under this Affordable Care Act. So, from my standpoint, this is a very complex bill. 2,700 pages. We have another 6,200 pages is what I was reading in terms of additional regulations that have been written since that point in time. So I try and simplify things. I'm trying to look at the bigger picture. And so I'd like to start by just asking some basic questions. We can kind of agree on some figures here, because I'm a very, reality-based guy, I want to look at facts and figures. So is it true that about 163 million people in America get their health care through an employer-sponsored plan? Is that about the correct number?
I think it's about 180
180, okay. The CBO has issued a report that claims that, under the health care law now, that by 2016, the average cost of a family plan will be in excess of $15,000. Is that pretty much your?
I assume that's inaccurate.
Okay. But it is. We'll stipulate that. Is it also true that under the health care law now, if an employer with more than 50 employees doesn't provide, I guess, affordable coverage, the penalty to that employer will be $2,000 per employee?
It's employer responsibility. If that employee qualifies for the taxpayer subsidy that is in the bill, then there is, yes, a payment into the fund so that that cost isn't shifted on to other taxpayers who are indeed providing coverage for their employees and paying for the subsidy.
Okay, so the CBO is also estimated now that they're thinking it's starting, I think, 2.6 million, rising to about 3.6 million employees will lose their coverage, will be dropped from their employer-sponsored care into the government exchanges. Is that about the right figure that?
Well, I know there were all sorts of studies done by all kinds of people, sir, during the course of the debate, and I think before we have a framing of a plan and the opportunity to look at how affordable these plans are. One of the directives, as you know, with the state-based plan is that it be affordable coverage. So I think there is not at all a firm number on how many employers will or will not do what they're voluntarily doing now.
That's how this thing has been scored dollar-wise in terms of the cost estimate, correct? About around 3 million people, okay? The average subsidy, according to CBO, is per person in those exchanges will rise from about $4,500 to over $7,000 by the year 2021. Is that largely correct?
The average subsidy is based on an income level to the individual.
But what's been budgeted is almost $7,000 by the year 2021. And so, I mean, here's really my concern. Is taking a look at the big picture here. I think we have grossly underestimated the number of employees that will lose their employer coverage plan under this Health Care Act, be put in the exchanges under extremely high subsidy levels. And if I'm right, if my fears come true, we could be looking at tens of millions of people put in the exchanges at the tune of $5,000 to $7,000 in subsidies. We could be doubling, tripling, quadrupling the cost of this health care bill. Rather than $150 billion, it could be easily $500 billion per year. I mean, that's my concern.
Well, Senator, I think, as you know, and as a business person participating in the market is entirely voluntary now for employers. I think the most cynical view is that employers will just dump all their employees, discontinue employee benefits, and I guess move people into some other option. I don't share that kind of cynical view. I think the voluntary marketplace, in fact, is going to be far more attractive. A lot of small business owners who now are paying 18 to 20% more for identical coverage to large business owners will have, for the first time, affordable options within an exchange to purchase coverage. I think that the opportunity for individuals, entrepreneurs, farm families, and others who right now are on the edge of the market or often outside the market will have affordable options. And I think the large employers who we talk to, who will not see much difference in their choices, except they'll stop paying the approximately $1,000 per policy tax for everyone who's accessing the healthcare system without affordable coverage that gets shifted on to everybody who has coverage. I guess I think that while there is a scenario that says everybody would voluntarily walk out of the market and dump their employees, I think just the opposite is going to happen. We haven't seen that in the one state that's really up and running in Massachusetts. Employers have not dropped their coverage, have not dumped employees. They, in fact, are continuing, and Massachusetts is now at about a 97% coverage rate. So I think that's an encouraging, at least, precursor of what may be coming.
Thank you.